Hi, and welcome back to Focal Point on AFR Talk. Honored and pleased to welcome to our decision maker line a frequent guest here on Focal Point with Bryan Fischer, Twila Brase. Twila is the president and co-founder of the Citizens Council for Health Freedom. She's also responsible for the Health Freedom Minute that you hear every day on Focal Point. Twila, welcome back to Focal Point with Bryan Fischer.
Thanks so much, Bryan.
You know, I want to start talking about the Health Freedom Minute from today because coincidentally, I posted about this morning. It has to do with the federal law that requires emergency rooms to treat everybody that shows up. Tell us about that law and tell us about the impact that law has on the cost of health care.
Well, it's a law that a lot of people don't know about it, and most of those who do talk about it as EMTALA, which is the emergency, I'm just trying to remember the words now, Emergency Treatment and Labor Act. And yes, it requires emergency rooms to take all comers, whether or not that individual can pay or not. And as a result, it's been kind of interesting. There are, particularly in California, where you know a lot of people have come over the line, from Mexico and other places. But there have been a fair amount of emergency rooms in California specifically that have closed. The hospital has closed the emergency rooms because if they close the emergency rooms, they close the entrance of these individuals, and therefore they protect their budget for everybody else. So, yes, there is this law. It was passed in 1986. And it's essentially a mandate to take anyone who comes in, no matter whether they can pay, no matter how much your hospital is struggling. It doesn't really matter.
And by the way, just for listening audience folks, that was done under President Ronald Reagan. He signed that into law. So that's, I think, was a huge mistake, at least in my personal opinion. So, you know, those of you who think I never am critical of Republicans, there's a case in point right there. Well, you know, and it seems to me, Twila, and let's address this first of all, because you talked about this in your Health Freedom Minute. Prior to 1986, if somebody who was indigent, somebody who was too poor to be able to pay the cost of care, if they came to the emergency room, were they just tossed out in the street, or was there an alternative for them?
There was an alternative. There were institutions that would provide indigent care. There were doctors, medical residents, et cetera, who would be at these facilities who would provide care for free for these individuals. And in that sense, you know, I think that we've really lost something with hospitals, and that is that hospitals have really turned into, for the most part, lots of them, into for-profit entities, even though they don't pay taxes. So the difference between for-profit and non-profit is that for-profit pays taxes and not-for-profit doesn't. And so they are tax exempt. But so many of the hospitals are working hand in hand now with the health plans, or they've just become big businesses. And the idea, they do some charity, but really they're not charitable institutions like they used to be. And so we've really lost those institutions for people who don't have resources. There was a place. Now, it's not like maybe sometimes a hospital didn't throw someone out. I'm not saying that it didn't happen, but there were places for them to send these individuals to. There was an alternative system. Well, and today there really isn't.
And there was an incentive then for the church and for people of faith who care about the poor. There was an incentive for them to set up these clinics where they could provide care for these individuals. There would be an incentive for the community to donate to a fund that could be used to offset the cost of emergency care. So it would call forth all of these good qualities: generosity, compassion, volunteerism. And if the government just steps in, well, we don't need you, we're just going to order hospitals to do it whether they want to or not, it takes away all of that. So it seems like it diminishes something in the American spirit and the American character.
Right, and I think that Medicaid, which is coercive or coerced charity, it's not really charity, right? But it's coerced. In other words, we have to pay taxes for the government to provide it. The government takes out a lot of money before it ever gets to institutions. The institutions never get paid for the cost of care, and yet they have to take all of these folks. And so charity is a much better system. in that what it does is people are giving charitably, and so it preserves charitability in our country. And we are losing the sense of charitability as the government takes more and more out of our pockets, so that we want to give less and less. We say, well, they're taken care of, so I'm not going to do it. But you know what? People on Medicaid are not taken care of so well. People on Medicare are going to find that they have less access to care, particularly since Obamacare happened. There's going to be a lot of people needing real charity, people who really care about them, who want to take care of them. And whether you're covered under Medicare or covered under Medicaid, you may not be able to get the care that you really need. And you're going to be looking for a doctor, someplace that will give you either for a lower cost or for pure charity what you need to actually thrive or survive. I think we've just had a great loss in this country when it comes to charity, and even the sense from patients of gratitude. This is something that's been lost in Medicaid. You know, it's an entitlement. There's no gratitude for the giving of others. So, you know, I really believe in the restoration of the mission of medicine and the charitability of medicine and the whole healthcare endeavor.
You know, one of the things I'm convinced of, Twila, is that if something is right, it's right for everybody. If something is right, it is good for everybody, even though people may not see it on the surface. Let me ask you this. I believe that'd be the right thing to do, just repeal that law. It's only been around for 25 years, so it's not like it's a part of the American experiment from the beginning. Repeal that law and provide this opportunity for generosity, for compassion, for medical clinics to arise that would take care of those who couldn't afford care at a conventional hospital. What would that do? If we did that, we would have this beautiful spirit of voluntarism and all that, charity, compassion, generosity, all that, actually touching people out of a heart of concern. What would happen if we did that? If we got rid of that law, repealed that law, what would that do to the cost of health care? How does this mandatory care in emergency clinics, how does it drive up the cost of health care?
Well, it drives up the cost of health care because hospitals have to try and figure out, they have to have their costs paid. Now, I wouldn't say that every hospital is, I think there's a lot of hospitals that are extravagant in themselves and perhaps doing all sorts of things that wouldn't be necessary if they had to streamline their services more. But what it does mean is when people who can't pay come into your emergency room and you have to take care of them no matter what, and you can't ship them anywhere else, what it does mean is they have to take those costs and they have to spread them to the government for higher taxes on people, or they have to spread them to private insurance for higher premiums on others. When people are giving of their time and their services, and people are looking at an institution as a charitable institution and providing funds there, that doesn't raise costs for anybody. Those who give charity are glad to do so, and that's something they give out of their heart. Those who are providing services do it out of their own free time, or they take a half a day off, and so they're not paid. That's charity to them. They're not paid for half of a day. And it doesn't get the government involved. I mean, the government is a terribly expensive way to provide care to anybody.
Another thing that would do.
You send the money in, you get all those processes to do that. Then they want to monitor the system, so you have to have all the systems do that. Then they want to take out their piece, and then they'll give you whatever is left over, and they'll say you have to provide all the care for this little chunk of change.
The other thing, we got government out of it. It would, and this mandatory emergency care thing, it would reduce the cost of people that can't afford to pay, leaving them more money in their pockets so they could give to these neighborhood medical clinics to take care of the poor. Now, I want to get to this before we're done. We just got a couple of minutes left, Twila, but I want to shift gears just a little bit and talk about what the Obama administration under Obamacare is doing to the Roman Catholic Church and to Catholic hospitals. I find this unconscionable, where they're going to mandate them starting August 1 of 2013 to provide contraceptives, sterilization, medications that can cause abortions, despite their conscience reservations about those things. Talk to us about that.
Yes. So there's been a regular march against conscientious objections, or the professionals' conscience or anybody else's, because this is not just against the Catholic Church. It's against anybody who wants to look for an option of a health insurance plan that doesn't offer something that violates their conscience. But there's been a regular march against looking at and valuing the conscience of providers and individuals, because President Obama and his administration they just chopped the conscientious objector standard or rule down to almost nothing. It used to be like 30,000 words. It's now like 200 and some, right? So they're really moving to take away the rights of individuals to not pay for things that violate their conscience. So in this case, there's very little wiggle room. It's very narrow, those folks who aren't going to have to provide contraceptives, sterilization, et cetera. And a lot of employers are going to have to provide this for their employees. Now, there could be a number of ways that the administration is looking at this. They might be hoping that these employers will therefore dump their employees into Obama's main method of giving us socialized medicine, which is the exchange. And we're trying to stop exchanges all over the country. That might be one thing that they're trying to do. The interesting thing to realize is that no matter what happens in essential health benefits, the administration says states can decide what they look like, but they said this one thing. They all have to keep this contraceptive piece in there, right? So, but the main thing I think the public needs to understand is Obamacare says that the Secretary of Health and Human Services has sole authority, one person for over 300 million people, sole authority to decide what benefits a plan must carry. And so she's, putting out this aura of flexibility except for the contraceptives at the moment, right? But they can do anything they want. They can make us pay through the nose for all sorts of things that we don't want. So this sole control, she has fiat authority. Nobody else can make this rule. She can add in there, she gets advice. She's required to look at the advice, but not to take it.
Now, I noticed that she's giving an exemption to those religious organizations that have conscientious objections, giving them a 1-year postponement, so it doesn't go into effect for them till 2013. Just got 30 seconds. That looks to me like a pure political ploy. They know it's bad medicine, going to be a problem. They're going to try to postpone it till after the elections. That way it looks to you.
That is the way it looks to me. It's still a requirement. At the end of the day, it's still required.
Our guest on our Decision Maker line has been Twila Brase. She's the president and co-founder of the Citizens Council for Health Freedom, produces the daily radio commentary you hear on Focal Point Health Freedom Minute, our go-to expert on all things dealing with health care and Obamacare in particular. Twila, thank you so much for taking time to be with us. We really appreciate the work you do. Thanks for the information you bring to us.
Thank you, Brian.
Twila Brase, president and co-founder of the Citizens Council for Health Freedom. We'll be right back with your phone calls and more. 888-589-8840. Stay with us. Back in 2.